What do we do when individuals are suffering and we allow them to become victimized and treated, as opposed to empowering them to be the heroes in their lives and for their community? Getting to care is extremely difficult. It's a maze. And I think we all know that. Anyone that's dealt with the bureaucracies of our lives will understand that getting access to resources, getting access to care can be unbelievably difficult. And ultimately, if we can leverage the veteran as a battle buddy based on that ethos which is developed during service to help the brothers and sisters navigate that maze, get to the resources that are needed, kick down the doors, whether it's at the VA or at other community organizations, it's a whole new day. I was speaking to someone earlier, I think his name was Zach. Zach came up to me and he's like, hey man, you were at LA County Department of Mental Health. I was like, yeah. And he said, you know this guy named Jim? And I was like, yeah, I do. Because he had just met Jim and they were talking about battle buddy programming. And Jim was the guy I met in 2008. And I developed with him the Bridge for Heroes program. It's the first of those battle buddy programs that I really worked on. Jim was a vet who was struggling with homelessness. His marriage had dissolved. He had fallen into addictions. Jim is now the director for the Department of Military and Veteran Affairs for Los Angeles County. And he's driving the Veteran Peer Access Network. And last week, Jim and I went to see a Vietnam vet who had developed Parkinson's disease, had terrible post-traumatic stress and other challenges that were invisible. And he'd broken his hip, and he had never connected with the VA. This was about 6 months ago. So we lobbied the VA all day long and veterans benefits for a guy that had been hiding from the system for that long. And it took 6 months to get him actually enrolled in the VA and to get his disability rating. And since that's happened, and since Jim and I have been connecting with him, his entire attitude has changed. He's now in a nursing home and he's looking to move more towards a less restrictive environment, but he's engaging with the nursing staff. He's engaging with other vets and he's been hiding from other vets for decades. But ultimately, it's all about people, place, and purpose in life. We have to be connected to kin, whether it's our family of origin or our friends or a support network. Otherwise, we need places to live, to recreate, to relax. And we need purpose in life.